There is a lot of that. I mean, I saw it with healthcare recently. Mm-hmm. With healthcare, I don't think that you can make any serious case from the left that healthcare is fine and the for-profit employer-connected system that we have is working. Like, I don't think there's any progressive case to be made for that. Where people will differ is, what about Medicare for all versus some other system that looks more like Canada's or the UK or Germany or whatever. And I've already started to see, like when I say on my show, I'm kind of agnostic on this. Like the system we have is a disaster. We need a system that will get coverage to everybody. The numbers can be made to work any number of different ways. We've looked at it. But 80% of people on Medicare, I believe it is, have some additional coverage. They either are still working part-time or full-time and get coverage that way, or they're poor enough to be on Medicaid. The point is, Medicare for all doesn't solve every issue. Right. It's way better than what we have.
Hey guys, welcome back to the channel. Today we're looking at how David Pakman calmly but completely exposes Joe Rogan's contradictions on healthcare, especially Joe's idea that profit is what makes doctors great. Pakman breaks it down in a way that's smart, logical, and honestly pretty educational. We all know the American healthcare system is broken, overpriced, overcomplicated, and leaving millions behind. And this conversation really shows why. Before we jump in, let me know in the comments where you're watching from. I love seeing people from all over connecting here. And don't forget to like, subscribe, and hit the bell icon so you never miss a breakdown. All right, let's get into the video.
But here's like a dozen other possibilities looking at other countries. There is a portion of the left that doesn't like that because I'm saying I'm against Medicare for all. I'm not saying that. What I'm saying is there are a number of different ways to improve upon the system we have, all of which sever this relationship between usually your employer and these for-profit insurance companies. Yeah, Why can't we be open to that?
I really don't understand private citizens that don't want easy access to quality healthcare for everybody. That confuses the shit out of me. Like, have you ever been hurt? Have you ever been sick?
Yeah.
Have you ever been broke?
Right.
Do you want to be broke and have no access to healthcare? No one does. No one wants anybody they care about to not have access to healthcare. Of all the things that we concentrate on in this country, there's two things that drive me fucking crazy that people just dismiss. Education and healthcare. The idea that you have to, like my buddy Greg Fitzsimmons, he's sending his kid off to school. How much did he say that it was?
65, I think.
$65,000 a year for both of his kids, for each of his kids. So, you know, he's got two kids. That hurts my head to even think about spending $130,000 a year just on, if you're a regular person with a regular job, how the fuck do you do that?
Impossible.
It's impossible. It's so much fucking money. And then that's not even paying for housing and food and transportation and books and everything else that you're going to need too. And to make it more difficult for young people to succeed is one of the worst ways to make a stronger country. If you want a strong country, you want educated people that get to pursue their dreams. And the idea that we are so willing to spend so much money on these costly regime change wars and flying troops overseas to these places that they don't want to go. No one wants it to happen. And it's trillions of dollars. And people are fine with that. But you talk to them about some sort of socialized education system, and people freak out and think you want to turn us into communists.
Well, I think what is really important to understand is that the facts you just laid out don't matter to people who see this as an issue of what do people deserve.
What do they deserve?
So if you say to a fiscal conservative, you know, if you consider the amount that the employee pays for premiums, plus the employer, plus your co-pays, plus co-insurance, you put it all together into some amount. And you explain to them there's lots of great analyses that have been done which tell us that with roughly the same amount of money, maybe a small payroll tax in addition, with roughly that same amount, it all could be done with a single payer system that covers everybody. It's the same. You're taking all of these individual risk pools where you have different for-profit insurers, and then you have systems for people that don't have enough money, Medicaid. You have systems for people that are over 65, Medicare. You put it all together, you spread the risk far wider. The employer no longer has to pay their part of the premium. The employee no longer pays part of their premium to the for-profit insurance company. The numbers work. They're still not going to say, you know what, that sounds great. It's actually pretty fiscally conservative. Let's do it. Because at some point, there is a portion of the right that just doesn't think people have earned health care. They just haven't earned it. They haven't,
education.
Or education.
Yeah.
That's right. And it's very hard to change people's minds when that's their view.
Our healthcare system is broken, and not just a little. It's broken in the way where people avoid the doctor because they're scared of the bill. That's not freedom, that's fear. David Pakman called it a disaster, and he's right. In 2025, families are paying record premiums and deductibles, while insurance companies post record profits. Medicare Advantage alone is overcharging taxpayers by tens of billions. So when people say we can't afford Medicare for all, we already pay enough for it. We just do it in the most wasteful way possible. At the same time, Republicans are pushing cuts to Medicaid and Medicare, which would leave millions vulnerable. That's why this fight matters. Because, as Pakman pointed out, some folks don't think people deserve healthcare. And in my opinion, that's the most dangerous idea out there. Here's the truth. Healthcare isn't a reward. It's not like buying sneakers. You can't shop around when you're having a heart attack. Every other advanced country gets this. We should too. So the question isn't, can we afford universal healthcare? The question is, how much longer are we going to pay more and get less?
I think might be George Lakoff who I believe calls it strict father morality, which is like, how would a really strict father treat a child who comes to them and says, hey, you know what? I figured out a way that we can all have health care. The strict father, even if the numbers make sense, would say, I'm going to teach you a lesson. You haven't earned that health care, either because you don't work or you don't make enough money or you're on disability, whatever the case may be. How do you convince someone to change their mind when that's their worldview?
Yeah, how do you? When it's an ideologically based decision and you're on team R or team L, you know, which group of ideas do you adopt?
Right.
Yeah. The UK system sucks. You talk to people that get healthcare over in the UK, it sucks. But at least they have a system. It's just not the same quality healthcare that you get in America. Same with my friends in Canada. I have friends in Canada that have come down here to get surgery because they find better doctors over here because they're
Rand Paul was going to Canada to get his operation.
Yeah, why was that? Why did he do that?
The best places in Canada.
The best place for hernias?
For that type of hernia, I believe, yeah. I mean, here's the thing. Even in saying the UK system and the Canadian system, neither one is that good.
Right.
Those two systems are totally different.
Right.
So I feel
but they're
like
both socialized medicine.
They are both, well, yes, in some sense. I mean, the Canadian system is administered at the province level. So the province is sort of like the market. Instead of having all these sub-markets attached to individual for-profit insurers, at the provincial level, that's how it's organized. The UK has the National Health Service, where they don't actually run the healthcare facilities, but they are the ones who are contracting them. So it's sort of like the healthcare facility still is its own entity. It's not that you're going and the government is the employer of the doctors, so to speak, but they're contracting with the healthcare facilities. But the point I want to make is that there are criticisms of all of these systems, but they're different ones. So when we say, the British and Canadian systems aren't that good.
Right.
Let's figure out in what ways each is not that good, because they're different ways. Whether you're talking about health outcomes, early detection, cost per treatment, whatever, you really have to drill down and figure out in what way are we saying it's not as good.
Yeah. What I'm saying is that there's no perfect system.
There is no perfect system.
Those systems aren't.
Right.
But I believe that most of the best doctors, in terms of like North America at least, are in the United States. I'm sure there's probably some very good doctors in Canada that do specialized medicine, but I think really good doctors are incentivized by profit. I really do. I think there is some motivation for, if you spend so much money for medical school and you bust your ass, you want to make a lot of money. And some of the best doctors earn a really good living.
That may be.
I think limiting their ability to earn that money won't incentivize people to be excellent.
Here's the thing about Joe Rogan when he talks healthcare. He's not a Republican. He doesn't line up with the GOP's official position. In fact, he said over and over that the US system is a disaster, that it makes no sense that people go broke just for getting sick. And that's true. Nobody can argue with that. But then, in the same breath, Joe turns around and starts dropping lines that sound straight out of a Republican debate stage. He says things like, the UK system sucks, or profit motivates the best doctors. And here's the problem. Those points aren't neutral observations. They're the exact arguments Republicans use to defend the broken system we have right now. Meanwhile, what are Republicans in 2025 actually doing? They're pushing massive cuts to Medicaid and Medicare. Analysts project 15 million people losing coverage over the next decade because of these cuts. Rural hospitals, especially in red states, are warning they may close because Medicaid reimbursements are their lifeline. And over 100 million Americans already carry medical debt, even though many of them have insurance. That's the system Republicans are protecting when they bash socialized medicine. So when Joe repeats those talking points, even casually, it ends up propping up the very side that's making things worse. It's ironic. He knows the US system is failing. He says everyone should have access, but he accidentally lends credibility to politicians who are actively taking that access away. And look, let's be real. Profit does not equal excellence in healthcare. If it did, we'd be the healthiest country on earth, but we're not. Americans live shorter lives than people in the UK, Canada, Germany, Japan, France. All countries with universal systems that cost way less. Their doctors aren't starving. Their hospitals aren't crumbling. They just don't bankrupt patients to keep the lights on. That's the contradiction in Joe's take. He wants everyone to have care, but by echoing Republican rhetoric, he's feeding ammo to the same people who are stripping care away. It's like he's arguing against his own values without realizing it. So the real question is, do we want a system built on slogans about the best doctors, or do we want a system where nobody has to crowdfund their cancer treatment? Because those are two very different visions. And in 2025, Republicans are betting on the first one, while millions of Americans keep falling through the cracks.
So a couple different things. I mean, number one, to be clear, we're now starting to get into a little bit of broader economic philosophy. Like, I'm a capitalist. I'm for social democracy, which is a mixed system. That's a capitalist system that says we're going to invest tax revenue in a particular way to make sure that no one falls below a certain level. So my just to contextualize that, my point of view is not from one of becoming a socialist country.
And
so,
I think we share those views.
I think so. A lot of doctors will say that even though on paper, in a socialized medicine system, they might make less for a particular procedure, for example, or something like that. A lot of them are still in favor of those systems because it would drastically reduce their overhead. So there's all of this apparatus that includes medical billing and coding, both on the insurer end and at the healthcare provider end. The hospital and the insurance company both are battling over what is it that was done?
Right.
What are the codes that apply here, and what are our reimbursement rates? There's fraud when it comes to that. And that requires an apparatus for investigating and adjudicating that. That adds more and more cost. So I don't think it's as easy, I don't think it's as obvious that under those systems, at the end of the day, a doctor that owns a PCP group, for example, or an orthopedic clinic or whatever the case may be, I don't know that it's that clear that they end up taking home less money.
That's interesting. I'd wonder if in practice that would play out that way. Maybe I'm talking about just like high-end orthopedic surgeons that do knee surgeries for athletes and things along those lines.
They often would be outside of whatever insurance apparatus we're talking about anyway. A lot of those folks are often being paid out of pocket anyway.
Yes.
So it's less...
At least some.
So for the average person's experience, I think it's less relevant.
Yeah. Then there's also liability insurance, which is extremely expensive. That's a giant issue with doctors. It's a huge expense.
It is, yeah. I mean, I think it is necessary. There's a question as to whether it's organized in the best way. I know less about that component than some of the other ones.
Yeah.
And this is exactly why Joe Rogan drives me crazy sometimes. You can tell he wants to sound logical, but then he completely misses the point. And David Pakman just calmly schools him here without even trying. Pakman starts by saying, I'm a capitalist. I'm for social democracy. And honestly, that's such a smart clarification. He's saying, look, we're not talking about turning America into some socialist nightmare. We're talking about fixing capitalism so people don't fall through the floor. That's how countries like Sweden or Germany do it. They're still capitalist. honest, just not cruel about it. And while Joe's stuck on this idea that doctors won't be motivated without big money, Pakman's out here explaining actual economics. He's saying, hey, doctors in universal systems often support those systems because they spend less time fighting insurance companies. And that's 100% true. In the US, doctors spend hours, literally hours, every week dealing with billing codes, arguing over reimbursements, chasing paperwork. That's not excellence. That's burnout with a stethoscope. Meanwhile, Joe's just sitting there like, yeah, but what about orthopedic surgeons for athletes? Bro, that's not the average person's experience. Most people aren't professional athletes paying out of pocket. Their families trying to afford a checkup without going into debt. Pakman nails it again when he points out that doctors in public systems might make less per procedure, but they also have way less overhead. They don't have to hire full-time billing staff or play insurance chess. Less stress, less waste, better outcomes. So yeah, this is where Joe gets exposed a bit. He's clinging to these lazy, half-baked talking points, the same ones you hear from right-wing pundits, while Pakman is actually breaking down how the system works in the real world. And Joe just kind of nods along, because deep down, I think even he knows Pakman's right.
That's what makes this part so good. Pakman's not flexing, he's just logical. Meanwhile, Joe's acting like he discovered capitalism last week. But that's my take. What do you think? Do you agree with Pakman's logic? Or do you still buy Joe's argument that profit keeps doctors excellent? Drop your thoughts down below. I really want to see where you stand on this one. If you enjoyed the breakdown, make sure to hit that like button, subscribe, and turn on the bell so you don't miss the next upload. Thanks for watching, and I'll see you in the next one.